Welcome back. Healthcare, I'm sure, is part of the reasons why the Ondo people are out today. They want to, they've heard from all of the candidates. They want to vote for people that they think, will take care of their health. And that's why we are talking about health here today. Healthcare is very essential, not just to individual, but of course to the entire society. And it's something that everyone must work together to ensure that it is optimum and it is an efficient system that we have. We're going to be zeroing down to Lagos State, and that's why we have here in the studio with us the Commissioner for Health, Professor Akin Abayomi, the Commissioner for Health, Lagos State. Good to have you here, Doctor.
Good morning, Yomi.
And we are not meeting at the IDH. We are not, there's not such an emergency for us, but it's good to prepare ahead of emergencies and make sure that the system is in top shape. Let's talk about the recent Lassa fever case. I know that Lagos, or you're close to Lagos, is having, some fatalities recorded. How is Lagos preparing for this?
Well, so we have, as you know, a specialized hospital for infectious diseases caused by dangerous pathogens, which is the infectious disease hospital in Yaba. That's where we look after patients with highly contagious pathogens, things like Lassa, COVID, Ebola, Marburg, yellow fever, monkeypox, anything that's extraordinarily out of the norm. Sporadically, we get a few Lassa cases in Lagos. And although we're not a center of excellence for Lassa, because we don't see that many in Lagos, but we do have a team that is trained to manage Lassa fever in Lagos. And so whenever we get those sporadic cases, we move them to IDH and we manage them there. And there's a whole group of Lassa experts around Nigeria, including the Nigerian Center for Disease Control. So once we get a case, we just start liaising with everybody and we find the best way to manage the case and manage the contacts, of course, and find out where did this case originate from, because there's always a transmission route, so this patient may have contracted it from somewhere, may have traveled. So we then inform the state epidemiologist of the state that they came from, so that they are alerted that there's a person that was in contact with this patient, maybe in Ondo State, maybe in Akure, maybe in Osun State, maybe in Delta State, so that as a country, we're constantly trying to create that network of understanding.
And I know some people may have forgotten, some of the factors that lead to Lassa fever. You want to just refresh their memories and how to prevent it from
Yes, it's
happening.
Typically a zoonotic event. So what does zoonotic mean? It means that there is a pathogen, a bacteria or a virus that lives in the animal kingdom. That's why it's called the zoonotic. And so when human beings come in contact with animals, usually wild animals, but it can be any animal, then the opportunity for a transmission between the animal and the human being exists. So Lassa is a typical zoonotic infection. It's a virus that jumps from typically rodents, but there are other kinds of wild animals that can normally live with this virus. So it's not as if the animal is sick. The animal is the natural host for these viruses. And this is the problem, because most animals that live in the wild have a number of natural hosts that they live with. And so when we encroach on their territory, or they come into our territory because we've disturbed their environment, then that human to animal contact starts to increase. And when that happens, then the opportunity for zoonotic events increases. So Lassa is a typical zoonotic event. So the rodents, usually rats, will come into your premises foraging for food. And in the process of doing so, they may pass some urine or some feces onto your premises, onto your food, because maybe they go into your gari or your beans or your rice, and they deposit the pathogens in your food, and unknown to you, the rat has come and gone, but the rat is foraging for food because the forest has been destroyed, so it's now looking to encroach on human territory because human territory is encroaching on their territory. So
now, Prof, still on the zoonotic, we saw pictures of people who had the monkeypox, and they were ugly, to say the least.
Yes.
And I know that up until September, we were given forms to fill regarding bringing monkeypox into Nigeria, but we haven't heard too much about it since then. Are you still seeing people who are presenting with monkeypox? And what has happened that we don't even get to hear about it anymore?
So again, this comes back to the zoonotic opportunities. So it's important that Nigerians know that there are two types of monkeypox. We have our own indigenous monkeypox, which is called clade 2 or type 2. And we see those. In fact, Lagos has seen maybe 1 or 2 cases every month. So we have our own monkeypox.
Does it look the same as those pictures we saw?
It looks exactly the same, but there are some minor differences. The other type is type 1, which has just evolved in Central Africa, particularly around the Democratic Republic of Congo and Central Africa. That type 1 seemingly is a little bit more contagious. It has a higher preponderance to spread during sexual contact. They've had a large number of cases in the DRC, especially in the eastern part of the DRC. And so we are looking at how that clade could enter Lagos through direct flights. So obviously we're linked to Congo. There's a direct flight from Kinshasa. There's a direct flight from Kigali. There's a direct flight from Nairobi, from Addis. So these are all East Central African countries where there might be an opportunity for a zoonotic event that has gone from the animal kingdom to the human kingdom, to the human population, and then someone flies into Lagos. But that would bring in the type 1. We have our own type 2 here. So there's a possibility that just like with Ebola and with COVID, we may see a type 1 coming into Lagos. But we haven't been able to identify any yet. But we do have our own type 2 that comes ever so often. We pick up the cases. We're not sure where it's coming from, but we're certain that it's also a zoonotic event coming from some animal. Well, it's called monkeypox, but it's not the only animal that can have it. It typically looks like chickenpox, except the pustules are a little bit bigger. Yes, it looks horrific, like you look horrific when you have chickenpox all over your body. But within 2 or 3 weeks, those pustules clear. But it is contagious during that period because the pustules break and then they go from one person to the other. So breaking the transmission between an individual with the pustules is very important for us. I guess that's nature's way of showing us that, oh, something's wrong with me, I need to isolate myself. Or when you see somebody that looks like that, you know that there's a possibility that you may get infected. And so the wise thing to do is to alert that person.
COVID-19 exposed a lot of vulnerabilities in health systems around the world, and of course Nigeria is not left out. I remember then, some makeshift tents, coming up just so we can accommodate the number of people affected. How would you say, for instance, Lagos State has moved on from there to building the health system?
Okay, so Ebola was the first eye-opener for us. We had never really encountered a pathogen of high consequence, as we call it, an outbreak that can shut down your economy and cause major sickness and death with a surge of cases overwhelming your healthcare. That's what happens when you have an outbreak caused by a pathogen of high consequence. So something happened during Ebola. We were able to, because of the historical strength of contact tracing in Lagos, and the Commissioner for Health then, Dr. Jide Idris, had a very strong surveillance team. And we were able to round up Ebola during the Ebola outbreak. But some of us on ground recognized that, wow, that was a lucky break. Sierra Leone, Liberia, and Guinea didn't get away with it, and it devastated their economy for decades. I mean, they're still recovering from Ebola. And so Lagos decided that we wouldn't be caught napping. And the governor then, Governor Raji Fashola, subsequently Governor Ambode and Dr. Jide Idris and a few consultants decided to prepare Lagos for a similar situation. And it was quite interesting because we commissioned a very sophisticated facility almost 3 or 4 months before COVID. So what we did was we looked at Ebola and we identified where the gaps and shortcomings were. It was mainly infrastructure and human resources, training people on how to manage these kinds of very dangerous pathogens, because they're not normal. And you need special equipment, you need to know how to manage them in the lab, you need to be able to diagnose them to start with. We didn't have all of that before. But after Ebola, we set it all up. And so when COVID came, we were, in Nigerian terms, quarter to ready, And so when we heard about what was going on in Wuhan, the governor, Babajide Sanwo-Olu, called us together and said, okay, something's happening in the world. What are we going to do? And I said, well, we've already been preparing, but we need to ramp it up now, because who knows, in the next 3 months, we may see. Nigeria has a very strong relationship with China. Lots of trading activity. Funny enough, it didn't come from China, it came from Europe, but we were ready and we started to ramp up. We've even recorded all of those. We've archived it in documentaries showing how Lagos started to ramp up in preparation for COVID. So COVID came and we managed to ride the 5 waves. I mean, it did disrupt us, as you know, but not as much as the rest of the world. And since COVID has died away, although it's still around, but it's not causing so much havoc anymore, we're now looking into the future. What is new? What is the new technology? We're digitalizing, we're building bigger facilities, we're looking at redesigning our infrastructure. We have the governor's blueprint for medical infrastructure transformation. All of that is taking into consideration the possibility of another big event. We just had a biosecurity conference. We always have them once a year. And Lagos has been hosting this event for the past 5 years, because Lagos knows that we're vulnerable, and therefore we need to benefit from the global understanding of how to protect ourselves from biological shocks.
Talking about bigger facilities, I haven't been to the infectious disease hospital, Yaba, in a while. Has things changed there? Because I know that facility needs to be bigger.
Yes. So what we built just after Ebola, we thought was big. But when COVID came, we realized, wow, we had thousands of cases coming in every day, samples coming from all over the Ibile zones of Lagos. I mean, it was like a mad market on drugs, And so we realized that things are okay, when you're at peacetime. But when you're under pressure, you really need to ramp up what you have infrastructurally. So what we built after Ebola, we realized is fine, but we need something bigger. And so the governor has given us the instruction to design an infectious disease research institute. It's about 5 times bigger than the Lagos State Biobank. We've broken ground, we've almost completed the designs. And so we're now looking for the resources to go ahead with building an infectious disease research institute that will continue to look at surveillance, to do research, to study the environment, to look at things like monkeypox and Lassa fever and Ebola and COVID. And it's not when we get a shock that we should be kicking into action. We need to be prepared, just like an army. You don't start to train your troops in the middle of a war. You train during peacetime. And so this is the time for us to build our strength, build our capacity, build our human resources, and prepare ourselves for shocks. Lagos is vulnerable because it's a mega city. It's probably the mega city of Africa. It has a huge inbound air traffic, port by sea, by road. We've got 25 to 30 million people to feed every day. So that means livestock is coming in. People are coming in. So when you have a mega city that has a heavy population density with a lot of movement of people and livestock and animals, traders, inbound by air, inbound by sea, it's inevitable that Lagos will always be the epicenter of something big on the continent of Africa.
Prof, it's okay to invest in infrastructure. That's all fine, but what about the personnel in these days of Japa? And we know for a fact that many of those who are Japaing are medical personnel, doctors, nurses, because getting jobs abroad is a piece of cake for them.
Yeah. So medical personnel are easy to poach because the rest of the world are looking for young, intelligent, well-trained medical professionals. So Nigeria is a sitting duck for poaching medical professionals, amongst other professionals. So what are we doing in Lagos? So Mr. Governor is very, very concerned about this matter. We are particularly better endowed than other states in terms of human personnel, but that situation is no longer tenable for us because even those in Lagos are jackpotting out. So we're thinking of several strategies. The first is people talk about brain drain, we're talking about brain gain. And we're talking about the circular brain. So what do those two terms mean? Brain gain means lots of Nigerians are working in the diaspora. They've become very advanced in specialist and subspecialist expertise. Many of them actually would prefer to be back in Nigeria. But what is it that would bring them back? So those are the things that we're looking at as Lagos State. It's infrastructure, it's welfare, it's security, it's real estate. But you have a subspecialist who is used to doing sophisticated procedures abroad, and you want him to come back home. You have to create the same environment for him to work, for him or her to work when they come back. So Lagos State, working with private sector, we're trying to diversify the skills that you can perform in the medical field in Lagos. So we're diversifying our hospitals in the public sector, and we're encouraging the private sector and enabling the private sector to also diversify. So instead of going to Dubai or to India or to UK or South Africa, if you need a brain surgery or you need a heart procedure or you need a kidney procedure, it should be available in Lagos, either in the public sector or in the private sector. If we set up that kind of environment, then our professionals will start coming home because most people want to be home and practicing and doing well at home. And then, when your pool of professionals is low for whatever reason, one of the reasons why it's low is because you're not making enough. And so we have embarked upon a very ambitious project to increase our medical professionals several-fold. So we have the Lagos State College of Medicine, which is part of the Lagos State University. So Mr. Governor has decided that we're going to establish a standalone University of Medicine and Health Sciences. And we're working on that assiduously at the moment, so that either by the end of this year or early next year, we're going to have passed the law in the House of Assembly. And we're going to set up an institution that just focuses on making doctors, nurses, dentists, pharmacists, and all the other allied health professionals in adequate numbers, such that even if a percentage of them want to jackpot, that we will still have enough behind. And hopefully, those that do jackpot, if we create that circular brain and that brain-grain strategy, eventually, they would have gone abroad, and there's nothing wrong with going abroad to expand your horizons or to learn new tricks and new skill sets. But then you should be able to come back home. So if you've gone away for 10, 15, 20 years, then Lagos and Nigeria should be able to welcome you back, because this is where you really belong and contribute to the health sector in this country and in this state.
Maybe let me, before we leave this issue of the health workforce, the ratio of doctor to patient, maybe health worker to patient, might be part of some of the things that we see in some of the hospitals. So there's not enough manpower, and the doctor is a bit lethargic, the nurse is a bit on the edge, and they transfer some of these things to the patients. How are you trying to create this balance? One, to make sure that, yes, when you're at work, you try to do your best. And two, in doing your best, you don't make that patient that has come to the hospital even feel worse with the kind of treatment or interaction that he or she has with the health worker.
So medical burnout is a global phenomenon. It's not just in Nigeria, but it's particularly bad in Nigeria and other African countries because our population, our doctor to population ratio is probably the worst on this continent in the world. So we have medical professionals, doctors, nurses, and everyone else treating 4 or 5 times the number of patients that our counterparts are accustomed to managing abroad. And we're used to that, but it doesn't mean that we should be comfortable with that, because our medical professionals are struggling with the burden of work, and many of them are suffering from burnout. We discovered this just after COVID because, we decided to investigate, what was the mental state, the psychology of our professionals. And we found significant evidence that they were fatigued mentally. When you're fatigued mentally, your sense of empathy goes down. And I think this is what you're describing, that, the next patient comes in and the professional that's seen that patient is tired, burnt out, hasn't gone home, has seen 10 times more patients than they should. You're not the friendliest person, and also you start to make mistakes. It's just like a pilot, there are rules and regulations as to how many hours you can fly, But what do you do when you're in a facility and the patients are coming in? Nobody's there to say, you've seen enough patients for today, you need to stop, you need to go home, you need to go and rest. If you do that, then who sees the patients? So it's a catch-22. And so government in Lagos, we're doing our best to improve the ecosystem of our health sector. The first thing is build better hospitals, build more comfortable facilities, not just for the professionals, but for the patients as well. Improve the welfare packages. So the governor is always quick to respond to the needs of our medical professionals in Lagos. And, we haven't had a strike in his dispensation that one can talk about. So he's very, very sensitive to the needs of the professionals. We're looking to increase their numbers. We're looking to bring professionals back home, and that's happening. All of a sudden, Lagos is becoming a very attractive place for everybody. I mean, something is happening in Lagos. We're not sure what it is, but Lagos is suddenly the place to be. And so that's also happening in the health sector. Our colleagues are coming home. And then there's what's called task shifting. So traditionally, it's not everything that a doctor used to do that needs to continue doing. Maybe we can share those roles and responsibilities. And then digital technology is also coming in. And, we can use a bit of digital technology to lighten the burden. And make things easier until we get enough people coming home and we can make enough, a lot more, and we can try and attain those WHO standards of 1 doctor to 1,000 patient population, which is not where we are at the moment.
Where are we in Lagos with that statistic?
Do you really want me to tell you?
I'm interested. Okay, I have.
We're not far off, but we're not where we want to be.
Certainly not. But we are hoping
that's big enough.
that we'll get there. Let's talk about health insurance. Out-of-pocket payment is very, when it comes to paying for health, and you have an emergency, someone is, then you are asked to go and pay this so amount of money, or it's not a very good thing for anyone. What is the state government doing in that light? I know that yes, the state government says, I think for people older than in certain age group they can get free, and then young people certain age group too. You can speak to some of these things.
Yes, so medical insurance is a global practice. In Nigeria, we're not accustomed to the concept of insurance. So even if car insurance or health insurance or property insurance, we generally tend to say, I'll wait for the catastrophe. I'll wait for the car accident, or I'll wait for my building to catch fire, or for someone to come and rob me or whatever. Same thing in health. People generally say, well, I'll deal with it when I get sick. But if you go abroad and more sophisticated environments, infrastructure environments, nobody pays cash anymore. You go and you see a medical professional, you put your card or your cards on the table, and automatically money and transactions move between the insurance companies and the healthcare providers. So what are we doing in Lagos? Well, the government did something very significant in 2022. The President promulgated the National Health Insurance Act law, President Buhari. And what that law did was to give us the means by which to start to drive a culture of health insurance in Nigeria. And that law said that every Nigerian must carry at least the basic minimum social health insurance enrollment. So it's now law that if you live in Nigeria, you must carry social health insurance. So it's up to the states now to domesticate that. So Mr. Governor has been very quick. In less than 12 months, we released the Lagos State Executive Order on domestication of the National Health Insurance Act, which mandates Lagosians now. So in the last 3 months, it's now become law by an executive order that all Lagosians must now carry social health insurance. Now, for a small figure of about 15,000 naira, it covers you for a period of a whole year for a basic minimum package, which covers medical checkups, fevers, birth control, immunization, minor operations, investigations, birth, cesarean sections. So 80 to 90% of what most Lagosians need. I'm not saying that if you have a major sickness that requires brain surgery and all that, it won't cover it. But then we will take you to one of our general hospitals to deal with that. But everything you need, if you have a fever, you need fertility medication, you need antenatal care, you need immunization. All that is covered with a basic health insurance plan. And so what we're trying to do is now enforce it in Lagos, encourage Lagosians that this is in your best interest. It pushes resources into the system. It makes the system more viable. It brings healthcare back into the mainstream economy. And when health is back into the mainstream economy, it now becomes attractive for investors, and so that's one of the ways in which Lagos is trying to change the ecosystem of healthcare delivery. And so you will see in 2025, we're going to be talking a lot more about health insurance. We're partnering with the private sector so that we can make it easier. If you already have a private health insurance, you don't need to go and buy a social health insurance plan. We're just going to fuse them and make it very simple for Lagosians. But we're going to be serious, and we're going to say, if you're living in Lagos, you're enjoying the commercial environment that this government is providing for you, your responsibility is to own social health insurance, which makes it possible for you to receive health care without out-of-pocket spending and what we call catastrophic health expenditure, because you never know when you're going to need that protection.
And they're sure to get the service.
And we're sure
because sometimes, people are skeptical about some of these things and say, okay, you just...
Well, it goes hand in hand, because when you pay your insurance, it goes into the system. The system, the finances start to revolve in the system gets richer, gets better, there's more competition. And so we're looking into a very bright future for health sector in Lagos.
Thank you so much, Doctor, for coming on this morning. We've been having a chat with the Commissioner for Health in Lagos State, Professor Akin Abayomi. We wish you all the best, and we're not hoping for any pandemic very soon.
God forbid.
Thank you.
Thank you, Alera.